Hi, I'm Dr. Dan Sindelar, and one of the biggest concerns in our country are sleep disorders. We all need sleep. There's a big problem in our country with lack of sleep. Sleep disorders affect, they say, over 80 million people. That's a good portion of our country. And out of that group, over 20 million have obstructive sleep apnea. Now, obstructive sleep apnea are the ones that not only snore, but they also have problems where they have interruption in breathing while they sleep. And that can be measured, and that is really a big risk, not only to their daily production and their daily activities and their daily enjoyment, but also a huge risk for their own health. The average person with sleep apnea is 4 times as likely to have a heart attack. They are 3 times as likely to have a stroke. They are 7 times as likely to have a car accident. This is really affecting our country in a vast way, and it's also affecting people we dearly love. There are a number of ways that dentists can play this important role. For starters, you can incorporate home studies in your own practice. We have a system where we have the patient check it out, they go ahead and do a sleep study, and then come back. We have it sent to a certified sleep physician. They go ahead and read the results. You can also coordinate with local sleep centers, and that's a great way for referrals of new patients. We have oral appliances that we've incorporated into our practice. Those are some of the simple ways you can get into sleep in your practice and add that as a huge profit center for your practice. To get started, it's as simple as taking a few educational courses in sleep apnea and in the appliances that are available. You can do simple cases right away. If you want to get more involved, which I have in my practice for some time, it doesn't take a whole lot more than that. Like everything else we do, we need to do our due diligence and keep up to date with things. But it is a rather simple process to get all of the systems in line to open your own sleep center in your own practice. You can start doing appliances immediately as long as you follow the steps, have the diagnosis by a physician, which is pretty easy to do, and then as simple as sending off cases. A lot of you have done Invisalign or Clear Correct, and those are similar systems where you get a little bit of education, you go as far into it as you feel comfortable. The other side to this is the lab cost for an oral appliance is minimal compared to what your return is on this. So your return on investment is quite good. I would say you're probably returning 4 to 5 times what your lab bill is. And then the most exciting side is medical insurances have just changed recently to go ahead and authorize payment for OSA appliances, oral appliances. And we're finding probably 75% of patients with medical insurance are getting really good reimbursement for these appliances. So by addressing sleep in your practice, it's a low-risk, low-cost opportunity. It will help your patients and it'll improve your practice. So do you or anyone you know have symptoms of sleep apnea? Please select your answer below.